This is Dr. Russell Blaylock, and you're listening to the Blaylock Health Channel. Today we're going to talk about some things that have to do with heart attack and stroke risk. A very important concept I think you need to understand, and that is about oxidized cholesterol and oxidized fats and lipids versus the cholesterol theory that you hear so much about. Now, just kind of get a grasp of what we're facing here with cardiovascular diseases and cerebral vascular diseases. About 600,000 people die of heart disease each year. Now, this includes heart attacks, heart failure, arrhythmias, angina, all sorts of things associated with the heart. So about 600,000 people are dying of heart disease each year. And that includes some 380,000 people who are dying of a heart attack, what's called coronary heart disease. Approximately 720,000 Americans are going to have a heart attack this year. And for about 515,000 of these people, this will be their first heart attack. And half of these will be men who will die of a heart attack and have no previous symptoms of any kind of heart problems. If we look at a map of heart disease deaths by region of the United States, by far the Deep South leads the nation in cardiovascular deaths and strokes. So the question is, why so many heart attacks occurring in the Deep South versus other parts of the nation? If the cholesterol theory was true, then you would think, well, number one, people in the Deep South must have much higher levels of cholesterol than other areas of the nation, and that would be explained only by a difference in their diet. That is, consuming something that would raise their cholesterol level, and we'll see whether or not that's true. Now, most doctors, starting in the 1950s and even today, were telling their patients that diet was the main source of elevated cholesterol, especially saturated fats. If you go to your doctor's office, almost the first words out of their mouth, if they find you have an elevated cholesterol, you need to cut back on your saturated fats, that is, animal fats. And from this, you assume that saturated fats are the main cause of heart disease, and that there's a lot of scientific evidence behind that. Well, if you look at the scientific literature and the large studies that were done looking at saturated fat consumption and heart attack risk, we find out, in fact, there's very little evidence of any connection between the two. And if one looks at a chart that was published by the USDA, the U.S. Food Database, and what this graph shows is changes in the consumption of various types of fat from 1909 until the year 2000. And when you look at this graph, what you see is that the consumption of saturated fats during this entire period from 1909 to 2000, the consumption of saturated fats was essentially unchanged, or almost a flat line. Yet during this same period, the incidence of cardiovascular diseases, and not just deaths from heart attack, but all cardiovascular disease, and including heart attack, was rising steadily. Now, if saturated fats were the culprit, you would expect the saturated fat consumption to also increase right along with the increase in heart attacks and strokes. But it didn't. What did parallel the rise in heart attack incidence was the progressive rise in the intake of polyunsaturated omega-6 oils, what we think of as vegetable oils. This was the result of a massive campaign by the American Heart Association primarily, some major medical universities and government health agencies, to convince the public that they should consume, quote, heart-healthy vegetable oils, which include corn oil, peanut oil, soybean oil, safflower oil, and sunflower oils. Now, why would they do that when this graph and the evidence seemed to point to omega-6 oils, the vegetable oil, as the culprit, not saturated fats? An even more important question is, why would they ignore this link between omega-6 oils and heart disease rates when it was so obvious? Before we go further, first I need to define a couple of terms and tell you why these things are being presented the way they are. and that is the difference between cardiovascular death rates and the incidence of heart disease. They're two completely different things. The incidence of cardiovascular disease tells you whether a proposed treatment, such as cutting out saturated fats or taking a statin cholesterol-lowering drug, has any impact on heart disease itself. In other words, not death from heart disease, but all heart disease. So if changing your diet and taking these drugs reduce the incidence of this disease, then you're onto something. Well, when we look at all the banter and all the talk that's in the media and in the literature and among your physician when you go to the doctor's office, they only talk about death rates. And what they tell you is that since we changed what people are eating, that is mainly cutting down on saturated fats and increasing the amount of omega-6 fats, deaths from heart disease has declined. And they show you the charts that show, in fact, death rates had been declining from cardiovascular disease and strokes. Well, the problem is that reduction in death rates from heart disease has very little to do, essentially nothing to do, with changes in dietary patterns concerning these fats. There are a lot of reasons why people are surviving their heart attack at higher rates. For instance, a faster response time by the EMS, the emergency medical system, when the ambulance comes. They resuscitate you at the scene, they give you drugs, they're in contact with the emergency room, you get immediate treatments. Better resuscitation techniques have been implemented by the EMS. And in the emergency room itself, there's improvements in emergency drugs, equipments. Many hospitals have special cardiovascular units that are rapidly activated when the heart victim comes in. And of course, public health campaigns alerting people about the symptoms of a heart attack. So they're aware that when they start getting that pain in their arm or in their jaw or shortness of breath, go ahead and call the emergency system and come into the emergency room. So this rapid response and the types and changes of treatment is things which changed. Now, younger people listening to this podcast may not even be aware that in the 1960s, most hospitals did not have staffed emergency rooms. If you went to the emergency room, you had to have someone call ahead, try to contact your doctor, find the doctor, get him to come into the emergency room to meet you there. But there was not a staff there waiting to take care of these patients. And most emergency rooms did not have cardiovascular resuscitation equipment. If the ambulance came to pick you up, it was just a ride to the hospital, like a taxi. There was very little that was done in terms of any treatment from the time the ambulance arrived and picked you up till you got to the emergency room. So these are the things that have drastically changed how we treat heart attacks and strokes. Now, some other things we need to understand about what we're told. We're told that high blood cholesterol is causing heart attacks and strokes, and we need to get your cholesterol level down. Most doctors just talk about total cholesterol, some mainly LDL cholesterol, but the story is pretty much the same, that it's elevated levels of cholesterol itself that's causing these heart attacks and strokes, and that's where we need to focus attention. Now, what the science says when we look at actually what are we learning about this, is that we find out that all cholesterol is not causing atherosclerosis. It's only a very small fraction of it, what's called the small, dense LDL cholesterol and small particle triglycerides. So it's not all LDL and it's not all triglycerides. It's just the ones that are small, these small particles. The larger particle of LDL, in fact, acts just like HDL. It's protective. And the large molecule of triglyceride doesn't seem to be playing any part in heart disease. Now the question is, well, why are only these small particles playing any part? Well, what we find out is that they're the ones that oxidize. They're quite easily to oxidize. So when they're exposed to oxygen or free radicals or lipid peroxidation, these small particles become oxidized, then they become very caustic. They're very damaging. And that's what's producing the atherosclerosis. Well, studies have shown that if you raise blood cholesterol but keep it from oxidizing It will not enter the wall of the blood vessel, and it will not cause atherosclerosis, the disease that causes heart attacks and strokes and peripheral vascular disease. Now, that's a very important finding. Unless that oil is oxidized, it will not produce atherosclerosis. The other important thing we find is that it's not just cholesterol that becomes oxidized, but all the fats in the blood vessel. And there's a lot of fats in blood vessels. The most abundant fat in the blood vessel is not even cholesterol. It's omega-6 fats. We call linoleic acid. Well, omega-6 fats are the ones that make up the vegetable oils, the cooking oils that you commonly buy: corn, safflower, sunflower, peanut, soybean oils. These are the oils that are high in this linoleic acid, this easily oxidized lipid. And so inside of the blood vessel, once this oxidized cholesterol and other lipids enter, they oxidize all the other lipids, and this produces the atherosclerosis because they're very irritating to the wall of the blood vessel. And this is what happens. All the white blood cells pour into there trying to get rid of these lipids, and that's what eventually produces what we call plaque. That's this crud that accumulates in the vessel. Well, if it's scientifically proven that only oxidized cholesterol and only oxidized lipids are causing the problem, then shouldn't we be looking at oxidized lipids that are occurring in our food supply? Well, one of the questions that arose immediately was, where is this oxidized cholesterol coming from? Well, initially, most researchers in this area assume, well, it must be the fact that we eat oils, and particularly cholesterol. It enters the bloodstream, and the oxidation is taking place in the bloodstream itself, or once the cholesterol gets inside of the artery. Well, what they found is that it has to be oxidized before it can ever get in the artery, so that's not where it's happening. And new research is finding actually that the oils are oxidized before you ever eat them. In other words, they're oxidized in the foods themselves, and then when you eat them, these oxidized oils begin to build up in the blood, and hence they enter the vessel wall and produce atherosclerosis. Now, studies have shown, and basically what they did, they went around to different restaurants to find out what were the practices of the restaurants in terms of their cooking oils. And they found almost all of them were using these omega-6 type oils for cooking, the corn oil, safflower oil, peanut oil, etc. And that in general, these oils are heated for 18 hours a day in these restaurants, and they're not changed except once every week, if that often. So these oils are used over and over and over for a week cooking the foods. Well, the longer they're heated, the longer you reuse them, the more you reuse them, the more oxidized these oils become. If you cook a food in these oxidized oils, the oxidized oils or lipids are absorbed by the food, and now the food is a source of intense oxidation. Well, they did studies in restaurants, looked at the foods that were fried in these oils, and indeed, when they examined 30 different foods, they found high levels of oxidized lipids in these foods. Well, of course, the next question was, do humans absorb this oxidized oil and these oxidized forms of cholesterol? And they did experiments in animals and they did experiments in humans and found out, yes, they do absorb them. And the next question was, well, if you have oxidized cholesterol and you're absorbing it, is that what raises the general cholesterol level? And they found out, well, no, not really. That these oxidized oils, when fed to animals, produce extensive atherosclerosis, but they don't raise the cholesterol level. And that's very important because, again, it shows that these statin-lowering drugs are doing something that's not actually attacking the problem. And this cholesterol theory, all these things you hear about cholesterol and high cholesterol, are not correct. It's oxidized cholesterol, even if it's in low levels. Now, if we look at cases of people who have atherosclerosis, anyone who's examined this, you see people who have extensive atherosclerosis, have had many heart attacks or strokes. And when you examine their blood, they have cholesterol levels that are extremely low, 150. One, I think a case was something like 116 nanograms per deciliter. That's a very low level of cholesterol. And so how if this cholesterol theory is true, could someone with such a drastically low cholesterol level have atherosclerosis and have repeated heart attacks and strokes of such a severe degree? And few people, and even few physicians, know that half of the people who have a heart attack or a stroke have perfectly normal or low cholesterol levels. Over half of them. This is not explained by the cholesterol theory. So it is explained by their oxidation. Next step, they wanted to know, well, what happens after you absorb this cholesterol, this oxidized cholesterol? And they also looked at oxidized lipids, but the oxidized cholesterol is the main thing they were looking at. And what they found is that you absorb this in this fat globule from your intestines called a chylomicron, and it's very quickly transferred to that LDL cholesterol molecule, the one the doctors all talk about. So when they looked at this, they said once you eat this oxidized oil, or food containing that oxidized oil, the oxidized lipid is very rapidly attached to that small, dense LDL cholesterol molecule. So now your LDL contains this highly inflammatory oil, and it's the one that goes inside of the blood vessel along with the other oxidized lipids. And they find that it's also easier to oxidize after it contains this oxidized cholesterol. So it gets even worse. And once it's in the vessel wall, it oxidizes the other lipids that are already there, and that magnifies this toxic effect of these oxidized oils. And eventually, over years, you develop atherosclerosis and you have a heart attack or a stroke. Now, the question is, if we have this science, and this has all been carefully done in the laboratory, both in humans and in animal models of atherosclerosis, why is this being kept secret? Why has not the regulatory agencies gone to the restaurants and tell them, you have to change the oil every day? You cannot repeatedly use this oil to cook foods. And why are we not telling them to use oils that are difficult to oxidize? And guess which ones that is? The saturated fats. So if you cook with coconut oil, you're less likely to have oxidation as a problem. If you cook with extra virgin olive oil, which does contain some omega-6 oils, you're going to have less of a problem. If you add curcumin in the form of the spice turmeric and pepper to the oil, it dramatically reduces the chance of the oil becoming oxidized. And when you absorb this turmeric into your system, it helps prevent the LDL from becoming oxidized. And so this is why when we look at animal experiments in which animals were fed curcumin or quercetin or these other antioxidant, anti-inflammatory flavonoids, we saw a reversal and a dramatic reduction in atherosclerosis, no matter what you did with the cholesterol. But no one is being told this. It's being kept essentially a secret. Why would they keep it a secret? Because billions of dollars of profits are coming from sale of these omega-6 oils, the corn oil, the safflower oil, the sunflower oil, even canola oil. Canola oil contains a large amount of omega-6 oils, and its omega-3 component is highly unsaturated. It also can become oxidized, that is rancid, and produce the very same problem. So cooking in canola oil is just as hazardous as cooking in corn oil. You don't want to do either. But what concerns me is no one's changing the policy, no one's telling the public about this. Now, when we look at the development of atherosclerosis, we find out it begins very early in life. In fact, they even look at babies. And in the coronary arteries, they start seeing early changes in the babies themselves. As they get older, about 10 years old, you begin to see the development of what we call fatty streaks in their arteries. And that indicates the very beginning of a problem. By the time they're 20 years old, these fatty streaks start transforming into what we see in adult atherosclerosis. So this is all occurring very early. Well, young children, almost as soon as they can eat, are going to restaurants, eating French fries, fried chicken, chicken nuggets, all of these things fried in these types of oil, and it's producing this rampant atherosclerosis. One of the worst of the oils was found to be peanut oil, which produces a very aggressive atherosclerosis when fed to animals. So what we need to do, since obviously the government is not going to do anything, the American Heart Association is not going to mention this, and the major universities, medical universities, are not mentioning this, is we're going to have to do it ourselves. That is, people need to avoid foods that are fried in these oils. They need to take more antioxidants, particularly mixtures of antioxidants, curcumin, quercetin, the mixed tocopherol, tocotrienol type vitamin E, the vitamin C as ascorbate, and the magnesium. All of these things help reduce inflammation, which is the key event going on with this oxidation, to protect yourself. But it just grieves me when I see little children in a restaurant with a plate piled high with these French fries, knowing they're eating a tremendous amount of these oxidized oils, and it's going to produce a high incidence of a risk, at least, for atherosclerosis, that is a risk for heart attacks and strokes in the future, and explains this continuing rise in the incidence of these diseases. So I would recommend that everyone start bringing about these changes, watch what your children eat, move away from these oils, and use the antioxidants to protect you against it. If you enjoyed listening to this week's podcast and would like to hear previous episodes of the Blaylock Health Channel, go to our website at www.blaylockhealthchannel.com. The information contained within these programs is not intended to replace or contradict that of your physician. This information is for educational purposes only.